Well, today in the USA Today, full page article, deadly bacteria on medical scopes trigger infections. When they get these infections, 40% of the people die. This is a mess. We're talking about endoscopic scopes, colonoscopic things, ones that are endoscopic, go down your mouth into your esophagus, down your stomach, and your duodenum, into your bile ducts in your liver and pancreatic ducts and so on. And, of course, this goes into the story we've talked about over and over and over and over, where you really need to do your own lab work on a regular basis, like once a month, once every 3 months. And you can get the books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and the new book, Epigenetics, and you can learn how to do all the laboratory work your doctor would do for an $800 to a $2,000 physical in his office. You can go to a pharmacy and get the same test strips he'll use in his office. You get them for $1.50 a piece. This would include test strips for blood. Of course, you do your own blood pressure, your pulse. You can get the test strips for urine. You can do your own weight. You can do things like the equivalent of a colonoscopic exam with an occult blood test, or a FIT test, which is an acronym for fecal immuno test. And the U.S. Department of Health and Human Services, says that each month you're looking at seniors. The medical doctors kill 15,000 seniors every month, and they send them into the hospital for these tests, and they're supposed to be minor procedures and screening tests. They kill 15,000 a month, 180,000 a year. When you look at just infections alone, 2 million infections occur in hospitals because of these tests, and doctors don't wash their hands after they go potty. And also, 90,000 die just from infections, okay? And so what are you going to do about it? Well, I urge you, don't wind up like Andy Rooney, who had his colon punctured by a colonoscopic exam, died at 92 at the hands of doctors. Nothing wrong with him. Okay, they talked him into this colonoscopic exam as a screening test. Dick Clark from American Bandstand, 82. He dies because they did prostate surgery on him, and he didn't need it, but they did it on him, and 3 days later he was dead. Actually, no, 3 hours later he was dead. He died of all kinds of blood clots, because when you cut on the prostate gland, it releases the hormones, which increase your risk of blood clots. Then our top astronaut, Neil Armstrong, first man to walk on the moon, personally saved 2 doomed NASA missions. They killed him at 82 with a, quote, elective cardiovascular procedure, unquote. Elective means really didn't need it. They just said, hey, we should do it. And then Joan Rivers, one of the more recent of the famous people, she dies at 81. She was having one of those endoscopic things down her throat because her voice was changing. And it was in a storefront clinic, as opposed to a hospital, because they anesthetize her, all this stuff. And these are just a few of the 180,000 a year they kill over the age of 65. How many of you over the age of 65, if you knew that airlines killed 180,000 seniors every year as airline passengers, how many of you would fly? Well, if you're over age 65, you wouldn't fly. Okay? So again, these figures all come from the U.S. Department of Health and Human Services, Office of Inspector General, which is essentially the auditors for Medicare and Medicaid, also the CDC, the Center for Disease Control, the FDA, Food and Drug Administration. All these agencies are jumping in here with this stuff, but doctors just keep on keeping on. So again, I urge you to get a hold of the book Let's Play Doctor, the book Let's Play Herbal Doctor, the book Passport to Aromatherapy. Get my new book, Epigenetics, The Death of the Genetic Theory of Disease Transmission, and learn how to do all these tests yourself. Again, particularly the book Let's Play Doctor and the book Epigenetics teaches you how to look at the numbers and determine if you need to go farther. Do you need, rather than X-rays and CAT scans and PET scans, things with lots of radiation, one mammogram, ladies, gives you the same radiation as 500 chest X-rays. Even the government says don't get them. The medical school at Harvard says don't get them. But yet doctors keep pushing them because that's how they make their money. Okay? I urge you, do your own self-examination. If you feel something unusual or something is there that didn't used to be there, something changes, something's painful that didn't used to be painful, get a high-resolution ultrasound. No radiation, you'll get the same results, but doctors don't make as much money. All right? If you do these things, you're going to add many, many healthy years to the life of your family, yourself, your workmates, your neighbors, your church mates, your pastors. And we have to do this. Doctors aren't going to suggest it to you, so you have to go out of your way a little bit here. Isn't it worth a few extra hours a month to add 25 to 50 healthy years to your kids and your grandkids' lives? Isn't it worth it to prevent all birth defects? You know, there's not a single birth defect that is transmitted by genetics. All birth defects are caused by nutritional deficiencies of the embryo. So think about the 90 essential nutrients. That's what we're talking about here. Most diseases that they're looking at are caused by nutritional deficiencies. You know, you get some infectious diseases like measles and the flu and things like that. But those really aren't that big anymore in the United States because we have clean water and we have fair high. The average person living under the bridge probably has better hygiene than a doctor. Okay? So we got to do these things. Again, all this is in the USA Today full-page article. Full page. It tells you how they rated this. It was very important. So you need to think it's important too. Well, we'll be back with more Truth, Justice, and the Youngevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us?
I thought we'd talk a bit about weight gain, as I've got an ABC News story here headlined, People Who Might Be Making You Fat. You see, research shows that if you eat with another person, you're put down more, 33% more food on average. And they go on to say that because scientists are, this is what's called the shared environment, they say your chance of becoming obese is 37% greater if your significant other is heavy. And Cynthia Sass, a registered dietitian, says that means you might want to use some teamwork, meaning that maybe you want to put your food in his and hers separate cabinets. And they go on to say that one study found that moms consumed almost 400 more calories a day than women without children. And then another one say that your chance of becoming obese increases by 57% if one of your close friends is heavy. And according to research, they say if you're going for a quick bite, tell your bud that you plan to order something healthy or even offer to split the entree and add a salad. A study from Arizona State University found that friends are more likely to be like monkey see, monkey do. In other words, if you tend to take the lead and eat more healthy food, your friend might as well. And they say that out-of-office lunch trips can be great for camaraderie around the office, but it's bad for your diet. According to a study from the Georgia University, they found that if you dine with a group of 7 or more, you will eat a staggering 96% more food. And they said one of the ways to get around this is to scan the menu ahead of time. According to another registered dietitian, Rachel Beller, says when the waiter comes over to the table, say you want a small piece of grilled salmon with the sauce on the side, and a double order of veggies that are lightly steamed or in light oil. So I know you would disagree with the oil portion of that, at least. Yep.
And of course, they missed the whole thing there because your close friends are going to be eating food from the same places. Certainly, married couples are going to be eating food from the same places. And if one's eating food that is minerally deficient, the other one's going to be eating food that's minerally deficient. And we need to send those guys a copy of the book, Hell's Kitchen. The subtitle, of course, is The Cause, Prevention, and Cure of Obesity. Obesity has nothing to do directly with eating too much nor lack of exercise. It's actually nutritional deficiencies. You take the nutrients, and everybody I've talked to, tens of thousands of people over the years, tell me as soon as they start taking the 90 essential nutrients, 16 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids, their appetite declines. They begin to eat less. And I was actually having lunch today with a lady, and she was telling me, she said, I didn't want to believe it. She says, I really enjoyed having the shakes and everything with every meal, breakfast, lunch, and dinner, or a vanilla shake or a chocolate shake. And as soon as I started with the Healthy Start Pack, within 3 or 4 days, I couldn't finish that shake. And then I started having one every 3 days, and then I started leaving them out, and I didn't miss them. And that was after years and years and years. And of course, that's because once you rev up on the minerals, your body stops yelling at you to eat more because it's missing these minerals. So eat more, by dumb luck, you're bound to run into some of these minerals. If you choose poorly and eat something that has lots of calories in it, or you're going to sit there and socialize while you're eating and eat 7 courses instead of 3, just because everybody's dipping in the melted butter and melted cheese and so forth and having one more drink, et cetera, 5 beers instead of 2, obviously you're going to gain weight. But once you start taking your 90 essential nutrients, 60 minerals, particularly 16 vitamins, 12 essential amino acids, 3 essential fatty acids, that alone will help you lose weight. You throw in the ASAP as soon as possible, guess what? You'll begin to lose a half pound to 2 pounds a day because it will accelerate the natural weight loss you get when you supplement properly. Thank you, Doug, for bringing that one up. We'll be back with more Truth, Justice, and the Youngevity Way on Dead Doctors Don't Lie for these messages. Okay, Doug, let's go to callers.
Let's head to Connecticut. And Deloris, you're on with Dr. Wallach.
Hello, Deloris, you're on the air.
Yes, I wanted to know...
Oh, you have to speak up.
Yeah, I want to know what you do for the hot flashes and also arthritis in the foot.
Same person?
Yes.
Okay. Let's see. Shar, are you there?
Here.
Hello, Shar.
Hello, Doc.
Okay. Yeah, you have to speak up, dear.
Sorry.
Okay. Let's see here. This lady, Deloris from Connecticut, she wants to know about hot flashes and arthritis in a foot. The same person.
The hot flashes is woman's FX,
Okay.
and the cramps in the foot and stuff are glucogel.
Yeah, arthritis, and so it'd be what basic program would you use then if it was arthritis in that foot?
One healthy bone and joint pack per 100 pounds of body weight.
Perfect. Okay, exactly that, Deloris. One healthy bone and joint pack per 100 pounds of body weight, and that'd be a little heavy here because it sounds like this lady, obviously not a guy, a lady, maybe in premenopause, menopause, or postmenopause. And so I would definitely do the one healthy bone and joint pack per 100 pounds of body weight. If the person weighs 150 pounds, I'd go for 2 of the healthy bone and joint packs. The woman's FX for the hot flashes, I would take 1 ounce twice a day. That'll be 2 quarts a month. And for other things that go along with menopausal symptoms and hot flashes, I get so many complaints from women there. They ask about the dry vaginal tract thing. And this is where the what we call multi-EFAs is made from evening primrose oil. It's legendary for dealing with that complication of menopause. It's called multi-EFAs, and it supports and promotes maximum benefit from your own estrogen, which is made by your adrenal glands in your liver when your ovaries stop making it. It's amazing. You make probably more estrogen from your liver and your ovaries than you do, your liver and your adrenal glands than you do your ovaries. So it's an amazing thing. Yeah, don't forget those multi-FAs. Throw them in there. You'll be glad you did. And will definitely make your intimacy a lot more fun. Okay, Doug, how much time we got here?
We got about 45 seconds.
Okay, well, let's start another one.
All right, let's head to Jackson, Mississippi. And Peggy, you're on with Dr. Wallach.
Well, Peggy, we got time for you to ask the question here. Before we start, what's up?
Okay, I started the your ASAP diet back in April of 2013, and by September I had lost 70 pounds.
Wow.
Well, I have done that cycle, the 6 weeks on, the 3 weeks off, 6 weeks on, 3 weeks off, and I have gotten to where I am stalled. Every time since I lost that 70, I'm not really able to lose properly. I always basically lose the 10 pounds that I gained when I was off of it, and I am in.
Okay, we got to run to this message moment here, Peggy. So hang on. We'll explain your problem after these messages. Okay, Doug, let's go right back to Mississippi and Peggy. Okay, before I can answer your question, I need to know how much do you weigh, current weight?
258.
Okay, that's after you lost the 70 pounds.
I've lost 88 now, but.
Okay. Well, congratulations.
It took me a year to lose that the next 18 going with, and I always end up constipated.
Sure. Okay, that's useful information. Okay, do you ever have any skin problems?
I have psoriasis.
Okay. And have you ever had respiratory problems as a kid?
As a kid, I had asthma.
Okay, Char, what are we dealing with here?
She's got a gluten intolerance, and she's not able to absorb because of the, damage it's done to the intestinal wall.
Perfect. Yeah, that's the basic problem here, Peggy. Remember, being overweight and obese is due to mineral deficiencies primarily. And you can absorb calories, but you can't absorb minerals. So as you're deficient in minerals, what happens is your body starts screaming at you to eat more, thinking by luck we're going to run into more minerals just by eating more. And that's why people tend to be overweight when they have a gluten intolerance, because they can't absorb minerals, as Shar said. And this drives you to eat more, trying to get those minerals. You don't know that, but you're answering your body's call to eat more to get more minerals. And so basically what you got to do is be drop-dead gluten-free. That includes yourself, spouse, dog, cat, bird, fish, mother-in-law, kids. Everybody living in the household has got to be drop-dead gluten-free. Absolutely no wheat, barley, rye, or oats, no fried foods, no processed meats, no oils, no gluten. And it's going to take anywhere from, how old are you?
58.
Okay. Yeah, so you've been eating gluten for 58 years, and probably before you were born, your mama was eating it and giving it to you through your cord blood. And so it's going to take maybe 4 to 6 weeks before you see any real benefit on a drop-dead, strict gluten-free environment and diet. And it might take you a full year to regrow your intestinal lining on a gluten-free diet. But as long as you're taking in the minerals appropriate for body weight, do you have any other things, any arthritis or back problems or anything like that?
Yeah, arthritis,
Okay. Okay, Shar, what would you give her as the basic program, and how much?
I would give her the Healthy Bone and Joint Pack for the arthritis.
Okay, and how many of those a month would you give her?
Well,
she weighs 258.
She really should have, ideally she should have 3, but if she can only afford 2, definitely 2.
Okay, yep, exactly right. The minimum of 2 of the Healthy Bone and Joint Packs. That's going to support and promote maintenance, repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae. Bone makes your bone itself. Plus, this is going to give you the minerals necessary to curb your appetite, because appetite is a deficiency signal of mineral deficiency. Then, optimally, as Shar says, you want 3 of those. You can take 3 full doses a day, but I'd rather have you buy only 2 and get yourself 2 bottles a month of the ASAP, because at least 2 bottles. Anytime you're 100 pounds or more overweight, you need 2 bottles a month of the ASAP. Take a dropper full under your tongue 30 minutes before each meal, and a dropper full under your tongue 15 minutes before a meal. Let it absorb through your oral tissues. And we'll be back after these messages.
Let's head to New York. And Tara, you're on with Dr. Wallach.
Tara, you're on the air.
Hi, Dr. Wallach. I just have, some symptoms with, I think it's my thyroid. I have issues with, my heartbeat, heart palpitations, and, whenever I get up from sitting down quickly, I have to, grab onto the wall because I'm, not sure if I'm going to stand.
Okay, let me ask you a couple of questions here. What happens when you lay down at night? Do you ever get anything going on when you lay down at night?
Oh, yes. Lots of heart palpitations and just, my heart just, irregular.
Let me ask you 2 other questions. One, maybe 3. Do you have a back problem?
Yes. Yeah, lower back problem and my neck and my right shoulder.
Okay. Now, do you have any skin problems, eczema, dermatitis, psoriasis, or rosacea?
Yes. Eczema.
That was a yes?
Yeah, eczema and really bad dandruff.
I'm sorry, what was the last one?
Dandruff?
Okay, no, there's some syndrome you said.
Thyroid?
Oh, I'm sorry, I thought you said syndrome. Maybe you said dandruff. Okay. And then, did you have any history of respiratory problems, asthma or bronchitis?
Whenever I was little, I had bronchitis a lot.
Yeah. Okay, what do you weigh, Tara?
I started gaining weight recently, but I'm usually 153. I think I'm 158 now.
Okay. All right, here we go. Shar, what do you think is going on here? Does she have thyroid problems or something else?
No. The vertebrae have gone away between her, or the cartilage has gone away between her vertebrae, and they're squeezing the nerves, and that's what's causing all this problems. And so it's a glucogel problem. Lack of glucogel.
Gluten intolerance.
Yeah, gluten intolerance too, because of all the other symptoms. But
yeah, she got psoriasis. She had bronchitis when she was a kid, and of course, Char's exactly right. You have heart palpitations when you change postures, when you get up from sitting, when you lay down at night, and she's exactly right. Do you know if you've shrunk any since when you were a kid?
No, I actually grew taller.
You grew taller. That's interesting. Okay, but you do have a neck and right shoulder and lower back problems.
Yes.
Do you ever go to a chiropractor?
Yes.
And what do they say?
They just always adjust me. They're just like, well, you're always having trouble with your lower back and your neck.
Mm-hmm. Okay, very good. All right. Basically, Char's exactly right. I believe you have something called atrial fibrillation. Have you ever been told you had atrial fibrillation or tachycardia?
No.
Okay, well, tachycardia is a technical name for rapid heartbeat, palpitations, and rapid heartbeat together. Usually a cardiologist would call that atrial fib or AFib, and it's almost always caused by a back problem, primarily between T1, 2, 3, and 4, and as Char says, usually it's degenerative disc disease, and you could have bone spurs causing this too, pinching these spinal nerves that come out from between T1, 2, 3, and 4, the first 4 thoracic vertebrae. These spinal nerves actually control the rate and rhythm of the heart, and doctors are eager to run up $500,000 worth of cardiovascular procedures when it's really a back problem, not a heart problem. They want to install pacemakers and defibrillators. They'll want to do what's called an ablation, where they kill your heart portions of it, hoping to stop this palpitation and tachycardia. When that doesn't work, and it won't because it's a back problem, they'll do what's called retroversion, which they electrocute you to death, hoping to reboot the heart. When that doesn't work, and it won't because it's a back problem, not a heart problem, you will be offered a heart transplant, and I wouldn't do any of that, okay? Give this 90 days. As Char said, 158 pounds, you need 2 healthy bone and joint packs per month, full dose of everything twice a day except for the glucogel. You want 15 of those a day, 5 at breakfast, 5 at lunch, 5 at dinner. All that will be accomplished by the 2 healthy bone and joint packs per month. And are you on any medication for the heart or anything like that?
No.
Okay, good. Well, I would get also the Cardio FX, which has English hawthorn in it, which is a great herb. Goes way, way back, and it's legendary for calming the heart down. And as long as you're not on any prescription cardiovascular medications, this is quite safe. And I would go ahead and, at 158 pounds, I'd go ahead and take, say, 3 of those twice a day, be 2 bottles a month. And then give us a call every couple of weeks. Give us an update, because I think we're going to be able to help you out here. Just keep track of your pulse, keep track of how many times you're palpitating, concentrate on when you lay down at night, see if there's any changes in degree or the severity of your symptoms. Same thing when you get up out of a chair. Okay, Doug, let's go to callers.
All right, let's head to California. And Jason, you're on with Dr. Wallach.
Jason, you're on the air.
Hi, Dr. Wallach. I was a question about the importance of daily iodine supplementation and how important that is for health maintenance, and what's the best form to take. I've been reading about the nascent iodine and Lugols, and I was wondering what the best form is to take as well. Yeah.
Okay, well, iodine, of course, is one of the 60 essential minerals, okay? And if you take a lot of iodine and you're low on the other minerals, you're actually going to make the severity of the deficiency of the other minerals worse, okay? So we rarely recommend taking lots of one individual nutrient unless you're already taking the appropriate base of the 90 essential nutrients. How much do you weigh?
130 pounds.
Okay. 130 pounds. All right. Any other issues? Do you have any skin problems, any eczema, dermatitis, psoriasis, or rosacea?
No.
Okay. Do you have any history of asthma or bronchitis?
No.
Okay, good. Any arthritis, high blood pressure, heart disease?
No.
Mm-hmm. Okay. Are you interested in taking the iodine because of Fukushima, or just...
Yeah, overall health and prevention of cancer, I've heard, is, I live in California, too, so there's a lot of seafood and stuff over here. I heard about the radiation, so preventative, too, I guess. So.
Sure. Okay. Well, Char, what would you do? What would you give somebody who wants more iodine? And what would be their basic program? And Jason weighs 130 pounds, so how would you start him out? What would be a sort of conservative, wise program for a guy that really doesn't have any problems? He just wants to do something right here. He weighs 130 pounds.
Well, because he said he wanted to avoid cancer, I would put him on the Healthy Brain and Heart Pack, because there's selenium in there, which is the granddaddy of all cancer, antioxidants against cancer.
Mm-hmm. Yeah, supports the immune system, exactly right.
Gold for the iodine.
So what I would do, Jason, is I'd go ahead and take that one Healthy Brain and Heart Pack, as Char says, get a hold of the Ocean's Gold. Take 3 of those twice a day. That'll be 2 bottles a month, and that's going to give you all the iodine you need, plus all the other 59 essential minerals, all the other essential nutrients. Call us every once in a while. Let us know how you're doing. Be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity and 90 for Life Crusade. And Doug, let's go to callers.
All right, let's head to California. And Steve, you're on with Dr. Wallach.
Hello, Steve. You're on the air. Hello, Steve. Okay, we got another one, Doug?
Yeah, I think we got Steve. Nope, we lost Steve. Let's head on to Oklahoma. And Lisa, you're on with Dr. Wallach.
Hello, Lisa. You're on the air.
Hello, Dr. Wallach. This is Lisa Wico, and I have been taking and running with a high blood pressure for the last couple of days. And, well, I was in an accident in 2000, and it split my head open in two spots across the left side of my head. And ever since then, I have been taking and just feeling like I'm just totally going down. I mean, I've got problems with my left shoulder and my wrist and my thumb, and with the high blood pressure.
Okay, how much do you weigh? Okay, how much do you weigh?
Huh?
How much do you weigh?
I weigh 252 pounds.
And how tall are you, dear?
I am 5'8".
Okay. Any other issues before you had the accident? Did you have high blood pressure before the accident?
Yeah, before the accident, I was put on Prilosec for a hernia in my esophagus.
Mm-hmm. Okay. So, here we go. Okay, Char, what would you do for a lady who's 5'8", weighs 252 pounds, probably 80, 90, 100 pounds overweight, depending on her frame? She has high blood pressure and suffers from secondary stuff to maybe a head injury. She's got some arthritis, maybe. What's going on? What would you do for her?
Well, I would. She's probably got a gluten intolerance with all these different things going on, I would guess.
Okay, so gluten-free diet. What supplement program would you suggest to her?
Well, she theoretically should. I would get her on the brain and heart pack and give her extra Ultimate Daily.
Okay, perfect. Ideally, as Char said, Lisa, you should have 3 of the Healthy Brain and Heart packs per month, a full dose of everything 3 times a day. If that's a financial burden, a minimum of 2. You'd take 1, you're not going to see much, although it'll be better than nothing. A minimum of 2 Healthy Brain and Heart packs per month. Then for the high blood pressure, I would also take, go ahead and take 9 of the Ultimate Daily tablets. That's 2 bottles a month. That'll be 3 for breakfast, 3 for lunch, 3 for dinner. And that's designed to support and promote healthy blood pressure, designed to support and promote healthy blood flow through obstructed arteries. And Char, what would you add to this program? Because she has a head injury, she's got things going on with joints in her body. What would you give her additionally?
I give her Glucogel.
Yep, Glucogel. I'd give her 20 of those a day, 5 at breakfast, 5 at lunch, 5 at dinner, and 5 at bedtime, a glass of water. That's going to require 3 bottles a month of the Glucogel, okay, to pull that off. And they're designed to support and promote healthy maintenance, repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone makes bone itself. And I didn't get whether or not the head injury was open still, but I'm assuming is closed and not draining or anything like that. Is that correct?
No, nothing is open right now. They had stapled it all to shut. Yeah.
Okay, so they reopened the head wound?
Oh,
okay.
Excuse me?
Did they surgically reopen the head wound?
What they did is they had cleaned it up and then stapled it shut. This is what I was told because I don't remember nothing for a full month after I was in the accident.
Yeah. Okay. Well, let's go this direction here. If the wound is still open, if the surgery has not healed, whatever they're doing, it wouldn't hurt. You could actually use the colloidal silver, say a dropper full in a couple ounces of water, and keep that wound wet and moist with that colloidal silver 2 or 3 times a day, and that'll help keep the infection down. Give us a call every couple of weeks, Lisa. Let us know how you're doing. And it wouldn't hurt to throw in the ASAP to help you lose the weight. Okay, Thank you so much, Shar. Super job as usual. Thank you, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.